and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about the assessment of HbA1c for glycemic control. For this discussion, I now invite Dr. Arun Mukka, who is our senior consultant endocrinologist from Yashoda Hospital, Somajigoda unit. And we are privileged and honored to have sir with us. Yes, sir. I welcome you, sir.
Thank you. Thank you, ma'am.
Yeah, and I also request all the beloved speakers in the panels to, introduce themselves. Yes, so over to you, Bindu.
Good evening, sir. Good evening, all. I'm Bindu Priya, working as lecturer from Government College of Nursing, Mehboob Nagar.
Yeah, Princy.
Hello, good afternoon, everyone. Good afternoon, ma'am. Good afternoon, sir. I'm Princy. I'm a government nursing officer in Hyderabad. I'm very pleased to be here today.
Yes,
good afternoon, all. Yes, ma'am. Thank you, ma'am. Good afternoon, all. Good afternoon, sir and ma'am. I'm Hema from Kurnool district. I'm community health officer in Kurnool district. Thank you. I'm very happy to have you today, sir, in webinar.
Instead, we all are happy to have you all. So let us proceed for the discussion, as this is a very interesting topic, and maybe the awareness among nursing and fresher or intern nurses are not seen much seen among. So yeah, let us proceed with the first discussion and insight from sir. Like, is diabetes considered a metabolic disorder? Sir, over to you. We wish to understand your insight on this.
So yeah, diabetes is definitely considered to be a metabolic disorder. However, we need to understand that there are certain other types of diabetes also. The commonly referred diabetes are the type 1 diabetes, which is because of the disturbances in the immunity, and the autoimmunity damages the insulin producing ability of a patient, often seen between age groups 5 to 15 years. Because of the continuous autoimmune process and damage to the beta cells which produce insulin, they finally become completely insulinopenic. They hardly produce any insulin, and so they develop a type of diabetes called as type 1 diabetes. This is a immune mediated diabetes. Type 2 diabetes, which is what we routinely discuss and which we come across in 95% of our patients, is a metabolic disorder because of various reasons. Now, it could be because of inappropriate weight gain, which causes the insulin resistance, or because of certain genetic predisposition, which causes the insulin resistance. Ultimately, what happens, the body does have the insulin producing ability, but the insulin cannot execute its function correctly, because of which the blood sugars go up. So this is the metabolic disorder. This is the diabetes because of the deranged metabolism of the body. Now, the third variety, which we call it as a secondary diabetes, could be because of the pancreatic surgeries or pancreatitis. That is an altogether a different thing. But the type 2 diabetes is a metabolic disorder.
Yes, very valuable insight, sir. And we do have a Hema, the other side. She is again community health officer. And when we were discussing this morning, she has received 20 patients. Among 20, there were only 5 patients who were, right from middle age to elderly age. They were all type 2 diabetes. They have come for the further follow-up and checking for GRBS, etc. So what is happening with the current prevalence of diabetes, sir? Like 4 out of 10 or 7 out of 10, it is only you can tell us, because you are the expert and you keep receiving a lot of patients in your OPD. Yes, sir, over to you again.
The prevalence of diabetes varies from country to country. However, we are talking of India, the current prevalence is estimated to be around close to 9 to 11% according to various studies which were done in 4 corners of the country. So almost 1 out of 10 is having diabetes. But there is a point to be noted that we are probably not identifying at least half of the patients who do not have diabetes. This is when we are screening the society for the presence of diabetes. This is the prevalence. But half of the patients probably do not even know that they have diabetes and they need to be treated. So if you see the genuine prevalence, it will be definitely more than the 10%, but the studies quote between 9 to 11%.
Yes. And yes, going forward, we do have other speakers who would like to ask their insight or few doubts from there. Yes, over to you, Princy. Yes, Princy or Bindu?
Sir, Bindu.
Sir,
Yes,
can I
Bindu.
know? Yeah, can I know what is HbA1c and how does it work? And does this test monitor long-term glycemic control?
Yes.
Yes.
Like,
See, we
yes.
need to, should I proceed? Should I proceed or is
Yes,
it?
yes, please, please,
Yeah.
sir. Yeah.
See, for every disease, we have to have a parameter to assess how is our treatment going on or whether that particular disease is adequately addressed or not. Now, it can be
Yes.
with the cholesterol, it can be with the blood pressures, it can be the creatinine, which to assess the various kidney functions. For the sugars, if you see historically, we've been relying on the urine sugars. In the initial
Yes.
stages of the
Yes.
diabetes, we were relying on the urine sugars. Over a period of time, we have learned that it is not the urine sugars, it is the blood sugars which should
Blood
be
sugar.
mentioned, should be
Yes.
checked. Over a period of time, it was also assessed that it is not just the 1 point blood sugars. Like we check the fasting blood sugar, we check second hour post glucose or the post breakfast blood sugar. That will tell you the sugar control on that particular day.
Yes.
But what is important for us to know is how good the control had been in the last few days also. For example, a patient has been prescribed medicine for 1 month and he's been taking the medicine for the last 1 week only. Now, if you check the sugar today, the sugars may be normal. But we need to have certain parameters to see how had been the control for the past few weeks or few months.
Few
And
months.
for
Yeah.
that, we have this test called as HbA1c, which is nothing but glycosylated hemoglobin A1c, which is measured by a simple test called as HPLC method. And we check this HbA1c to see how good is our control in the last 3 months. This basically detects the hemoglobin getting exposed to the sugar, and if the hemoglobin is exposed to the higher levels of average sugar, the HbA1c will be on the higher side. Most of the times our target HbA1c is close to 7. To have a good HbA1c below 7 means having a good control.
Yes.
Yes, that is a very nice way of giving the information, sir. Yes. So you mean to say after this result, we can plan the personalized treatment modalities for that particular patient, sir? Yes.
Definitely,
Yes.
because this test tells us that how good the patient had been with the medications, how compliant the patient has been medications, because many of them skipping the medicine is definitely often seen with our diabetic patients. This
Yes.
happens with all the other diseases. Now,
Yes.
sometimes when we are not sure if the patient had been regular with the medication or not, we'll have to check the HbA1c to see how good the control had been. So this is a very easy test, simple sample to be collected. When you're collecting the fasting or the post-breakfast blood sugars, you can collect the extra blood in the same sample and it can be assessed very easily, which will tell us what had been the control in the last 3 to 4 months. There are other parameters also like serum fructosamine. The other tests are also there, but they are not completely validated. The worldwide acceptable test to see the glycemic control is HbA1c.
Yes. So yes, as you rightly said, and we request all the fresher nurses, even interns, that you must update yourself with this glycemic index. Yes. Over to you, Princy.
Sir, we heard about pre-diabetic state and diabetic state. So how can we identify the pre-diabetes and the diabetes?
Yes, the best way to know what is the sugar status of the patient is by doing a blood glucose levels. And we do, if you want to screen any patient for diabetes, we do something called as glucose tolerance test, in which we collect two samples. One is the fasting glucose levels, and we give 75 grams of glucose for the person to be consumed in a 5 to 10 minutes time, and collect the second sample of the glucose 2 hours after the consumption of the
After,
glucose.
yes.
Now, if you see in a normal non-diabetic subjects, the normal values are the fasting below 100 and the post glucose value 2 hours after the glucose is usually lower than 140. Now, if somebody has a fasting glucose value of more than 126 or the post glucose value more than 200, we call them to be having diabetes. However, if you see there is a gap between the values. Now, people who have a fasting sugars between 100 to 126 or people who have a post-glucose value between 140 to 200, they are falling into a borderline category. That is, neither they are diabetics nor they are completely normal. However, these people are called to be having pre-diabetes. Why did we give
Pre-diabetic state.
pre-diabetes?
Yes.
Okay.
That means the people who fall into this group of blood sugars are at 25% higher risk than the other people to develop diabetes in the next 5 to 10 years. So it is very important to identify those people who are in a risk of developing diabetes and start implementing measures to prevent the
Preventive, yes.
conversion of pre-diabetes to diabetes. That is why it is important to know these people.
Okay.
So,
Thanks.
yeah, greatly, very well explained, sir. Yes, so we do also have Hema, the other side. Yes, as sir has already explained about OGTT and HbA1c. Yeah, you can always, ask your insight. Yes, Hema, over to you.
Sir, is there any transdermal patches for the diabetes, sir, instead of insulin?
The usages of the transdermal patches, the way we use it for other hormonal things like estrogen or testosterone,
Yes.
is still in the evolving phase. We are still having certain bottlenecks because the dose of this medicine to be delivered by the patches can differ from person to person. So as of now, we do not have the method to deliver the transdermal insulin, but slowly we may have very soon the inhaled insulin. That is something like a nebulizer kind of device
Yes.
may get launched in another few months for our diabetic patients. As of now, the only acceptable way of taking the insulin is by using the insulin syringe or the insulin pen. But we may start having a inhaled insulin very soon. Maybe by the end of next 6 months, we should be having it.
Yes. So yeah, right. Super technologies are on the way to ease the patients. Yes. So sir, I also wanted to ask, these two are very core golden thumb for the biomarkers for this diabetes, like you were mentioning GTT and HbA1c. Yes. Yes. So over to you, Binduji, for your concerns. Yes.
Sir, can you draw us an insight on what are the risk factors for pre-diabetes?
Again, the risk factors which diabetes has also are applicable for the pre-diabetes. As we have already seen, we are talking of type 2 diabetes. Type
Yes.
1 diabetes is something which can happen because of the immune predisposition. So that is got no risk factors. That is just a mild genetic predisposition, but it is the type 2 diabetes which has got multiple risk factors to develop the insulin resistance. Now we develop insulin resistance whenever there is a weight gain. So when would be the weight gain? Whenever there is a lack of physical activity, the person is not physically active to burn calories or to lose weight, or if the dietary patterns are not adequate. Of late, as all the other animals, they eat to survive. But if you see the human species, we have started adopting to eat for the sake of pleasure. Even if you're not hungry, you start eating for because you like it, or you know you have made a good food. So eating for a pleasure is something which is causing inappropriate weight gain. The third thing is the genetic factors, which many people tell us. If either of
Yes.
my parents have diabetes, what are my chances of developing diabetes? Usually the genetic predisposition is to the tune of 15 to 30%, depending upon the fact if one of the parents or both the parents have diabetes. But most of the times it is because of the insulin resistance, which is again because of lack of physical activity and increased consumption of the food, both causing the weight gain and the insulin resistance.
Yes. And sir, the childhood diabetes, I mean, that is also very prevalent nowadays because of the, inbound state of they are also not physically active. I mean, everybody is towards
Correct.
the technology and they consume a lot
Correct.
of ultra processed foods,
Exactly.
all that.
Exactly.
Yes, yes. Yeah, going
Exactly.
forward again, yes, Princy. So, yes, Princy.
So actually, we know what is pre-diabetes and diabetes. So the normal public, like how can they know like silent warning signs of diabetes so that they come to the doctor and can done a test.
Exactly. Now, when you have fever, you go and seek the help of a doctor. You
Yes.
have a cough, you go and seek the help of a doctor to get treated.
Yes.
Unfortunately, 70% of the times, the patient does not have diabetic symptoms till the time they do the test for some other reasons. Now, it could be a routine health annual checkup, which they're doing. It could be pre-employment check, or it could be an annual employment check, or they got it done just before the surgery. That is how 70% of the diabetic patients will come to know that they have diabetes. That is because when the sugars are slightly elevated, mildly elevated than the desirable range, they do not have the symptoms. However, when the sugar levels get significantly elevated above the renal glycosurial threshold, like if they go something like 300 or 350 or 400, that is when they start experiencing excessive urination. Now, excessive urination can trigger the excessive thirst. Excessive urination and the loss of glucose in the urine can also cause weight loss, and this again can trigger the appetite, and so they start feeling increased hunger pangs. Sometimes, if the diabetes is of chronic weight duration, it may have the effect on the nerves, causing disturbed sensation in the nerves like tingling or burning sensation. If it affects the eye, they will have a blurred vision. Sometimes the numbness of the hands can be there in the hands also. And as I said, very high diabetes undetected for a long reason can give you a can also present as a weight loss. But unfortunately, only 30% of our diabetic patients present with these symptoms to be detected to be having diabetes. 70% of them are asymptomatically detected when they are going for some kind of check, as we have said, for the employment check or a pre-surgical
Yes.
checks.
And then it is ruled out. Yes.
Exactly.
Yes. Yes. So yes, and yes, Hema, we wanted to also understand HbA1c a little bit about. Yes, Hema.
Yes, sir. Sir, is there any preventive measures to avoid to get the hereditary diabetes mellitus, sir? Can you please explain, sir?
Yes, this is probably the most important question which we all should be aware of.
Yes, yes.
Many of us are not aware that diabetes is something which is actually preventable. As we have said, that lifestyle disorder, that is because of the increased weight gain, diabetes is happening. Now, in order to see if this disease is preventable by simple preventing the weight gain or doing an exercise, a very famous scientific study has been done, which is called as diabetes prevention study, which is done in the Scandinavian countries, the Northern European nations, wherein they have divided the people into two groups. The people who have the borderline sugars have been divided into two groups. Now, the one group was made to walk for at least 30 minutes a day for at least 5 days in a week, which means 150 minutes of exercise per day, and follow the healthy diet. The other group was just given the healthy diet and they said there is no need to do the
No
exercise.
walk. Yes.
At the end of 3 years, what was found that people, both the groups were following a healthy diet, but the
Yes.
group which has not done the exercise, more and more people were getting converted into diabetes than the people who were doing the walking for 30 minutes. You will see that a simple walking for 30 minutes a day for 5 days in a week, which means 150 minutes of exercise, could prevent the development of diabetes in 60% of the people. So you mean that by simple walking 30 minutes a day, we can actually bring down the risk of developing diabetes by 60%. Now tell me which medicine can prevent any disease by 60%. So walking 30 minutes is as effective as 60% prevention of diabetes.
Yes. Yes. Very, very great and very valuable information you just quoted by giving one of the strategies in Northern Europe. Yes. And sir, even I wanted to understand what is the ideal frequency for this HbA1c. Like I tried mentioning little content about 3 months or 6 months for who is already unstable, glycemic control is not seen, and or maybe like us, when we should also, get it checked, like annually 6 months, yes.
Yes. For people in the borderline diabetes or the pre-diabetes, we would recommend it once in 6 months to 12 months because they're not on any treatment. We would encourage them to go for the lifestyle measures like walking. However,
Okay.
subjects of diabetes who are already on medication, now the frequency of the HbA1c depends upon how good they are with the medication and how good is the control. The people who do not have a good control of the sugars, we try to do it every 3 months to see how compliant they are with the medication and how good is the control. But someone who has been having a very stable sugars, whom we have a confidence that they have been consistently taking their medicines correctly, we can ask for the HbA1c once in 6 months also.
6 months also. Yes. And sir, again, this we wanted to always understand because this is the current which is booming in the market, and it is
Yes.
only you can provide your insight because we have conventional analog insulins, we have Alantus, and we do have this OHA substitute, medication. But what is this GLP about, sir? Like, is it again majorly, prescribed, like as do you prescribe? Yes.
Yes. Till now, we have understood that it is because of the inappropriate functioning of the insulin or the secretion of the insulin which is causing the diabetes. But
Yes.
however, it was also found out that there is a mechanism called as the incretin effect, which contributes to the insulin producing ability and insulin secretion ability of the diabetes. So this is kind of a root cause in the type 2 diabetes also. Now they have found out that there are certain medications which actually increase the levels of this hormone called as glucagon-like peptide. Now we had tablets in the past to improve the levels of this particular hormone because this GLP-1 is the one which was actually preventing the damage of the insulin, which is the one which is also increasing the production and the secretion of the insulin. So the treatment therapies have been developed to increase the levels of the GLP-1 by means of giving certain tablets. However, in the recent past, it was noticed, what if we give a GLP-1 like molecule into the body?
Yes.
That is
Yes.
where the new molecules have come. There are so many molecules which are available in the past also. Once weekly injections, twice weekly injections, once daily injections are also there. Currently, we have few set of wonderful molecules which are called as GLP-1 receptor agonist, which increase the levels of the GLP-1, which are again injectable preparations which can be given in once weekly. They are one of the highly efficacious molecules in controlling the sugars. Not only the sugar, they are also known to improve the cholesterol levels as well as trying to bring down the body weight also by
Yes.
controlling the appetite patterns. As we have said, we have started developing a pattern of eating for the pleasure, not just for the sake of survival.
Yes. 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 Those are like, yeah, eating for the satiety, needs. Yes. And yes, Binduji, you wanted to ask a few things about exercise and diet. Yes, over to you.
One more question, sir. Does chronic untreated diabetes affect all the vital organs?
Yes. Untreated diabetes is the one which will cause a lot of damage to the vital organs. Now, there are two types of damages which are described for the diabetic patients. That is the microvascular and the macrovascular. So the name depends upon the type or the size of the blood vessels. The microvascular complications are the complications which affect the organs which have got a terminal small vessels in the supplying their organs. Now, this includes the eye problem, retinopathy, the neuro problem, neuropathy, and the kidney problem, the nephropathy. Now, controlling the sugar from early stages, having said, can prevent the occurrence of retinopathy, neuropathy, nephropathy in a significant way. And this has been proven beyond doubt in both the type 1 diabetes as well as the type 2 diabetes also. Now, the second set of complications affecting the macrovascular, the large vessel complications like gangrene or the stroke to the brain or stroke to the heart, the MI, they can be significantly brought down, but there is a inconsistent data as far as the trials are concerned. But the current data in the recent past have been showing that by treating diabetes, we can actually significantly bring down these complications also, both micro as well as macrovascular.
Yes, yes. And yes, very great insight about this. And we're just going through your health talks as well. And again, I would like to ask, like, yes, diabetes can be reversed. Yes, it can be reversed with the combo of diet and exercise if at all it is consistently and with great discipline one has. Yes, sir.
Yes. Now, the reversal of diabetes, we need to understand, is possible only with the type 2 diabetes.
Yes.
Now, the damage has happened to the pancreas because of the pancreatitis cannot be undone, or the damage which has happened in the type 1 diabetes because of the immune disturbances cannot be undone. When we are talking of reversal diabetes, we are strictly restricting ourselves only to the type 2 or the garden variety of diabetes. Diabetes is reversible in certain set of people. It is not a completely misconception that reversible is not possible. It is definitely reversible in some set of people, but we need to understand that it is reversible effectively in the early stages of diabetes, wherein the requirement of the medicine is also on the lower side, especially these subjects who are, if they are obese or not having a good lifestyle, by encouraging them to have a regular walking and trying to lose weight, we can bring down the insulin resistance in these people and can probably get rid of the medicine. So reversible is definitely possibility in these patients. But we need to understand that reversal is different from remission. Remission is controlling of the sugar and in the normal range. Reversal is completely the diabetes is gone, which is like, not possible in all people. It is possible in small set of people.
Yes, yeah.
Advanced stages of diabetes may not be reversible. People who have been on a high dosages of medication, long duration of diabetes like 5 to 10 years, or people who are on insulin already, the reversal may not be possible. It may be partially reversible.
Yes, yes. Yeah, and it remains like the myth, as you said, it is a misconception about, yes. And yes, I think, yes, you already have mentioned walking, jogging, and at the same time, taking care of the feet and food also is very important, at least 30 minutes. Yes, a great insight. And I think anybody has any other concern to be asked, and I think we end the session after this. Yes, other side, yes.
I have one question. Sir, actually, as you are told, you said that HbA1c range. So when the insulin to be given, if at which range we can give insulins to the patients?
No, at the time of detection, if the HbA1c is higher side, like something close to 9 or 9.5, we would start these patients directly on the insulin. And after a good glycemic control has been achieved, we may slowly bring down the dose of insulin. However, if the patient sugars are not, this is for the patients who are on de novo detected diabetes. However, if the patient has been known diabetic for quite some duration, and when we have already used our medications, like, more than 2 to 3 drugs, oral drugs have been used for the diabetic patients, and still the diabetes is not under control or in the desired range, that is when we go for the insulin also. That is usually after about 2 to 3 types of oral drugs, we try to go for insulin if the sugar control is not good in a chronic diabetic patients. In de novo patients, if the HbA1c is more than 9, it is advisable to start them on insulin, at least for a short duration, to control the sugars.
Yes. Oh, yes.
Okay, so thank you.
Though very, fundamental, but then very great, sir, that you have provided your insight. Thank you for your valuable time, and thanks everybody, like speakers. It was a great association, talking to you all. And I urge all the speakers and viewers to refer our website, which is www.yashodamil.com, for academic updates. We do have very plentiful information as to clear a lot of misconceptions, myth and facts as well. Yes. Stay tuned to the same, and thank you, sir, for your great time. Thank you.
Thank you,
Thank
sir.
you, sir.
Thank you all.
Thank you, sir. Thank you, sir. Thank you, ma'am.
We end the session.